How you doing, guys? Happy Wednesday afternoon. Dr. Thompson here with Exemplify Health Center. Coming at you live within the trenches here at the office. So if you look behind me, this is where a lot of the magic happens. Today from 3:30 until 6 o'clock. Have a couple more consultations after that, so I'll get done about 7. I definitely don't work a 9 to 5, but I wouldn't have it any other way. So I wanted to talk to you about, if you read the description today, something that's really interesting about thyroid issues. Has your doctor looked here to see what one of the top causes of having a thyroid issue actually is? Before I do that, I want to get your opinion. It has nothing to do with a front door or anything like that I've talked about in the past. I want your opinion. So if you're watching this either live or you're watching this as a replay, let me know what you think of the new Kanye album. Let me know your thoughts. I've actually have listened to it, and I actually like it. So if you like it, give me a thumbs up. If you don't like it, give me an angry face or something like that. So let me know if you like the new Kanye album. All right. So if you're popping on right now, make sure you say hello. Give me a wave, and let me know that you're watching right now. And if you have any questions along the way, make sure that either type in a question, I'll make sure I get back to it, or go ahead and send us a message. So let's get into thyroid, all right? So one of the things I'm always doing is I'm always learning interesting things, always learning, and to help people become the best physician, obviously, for themselves. And so that's the thing. I think that we need to be, as I heard a little while ago, to stop listening and start learning. And what I mean by that is that we need to actually, rather than just listen to other people's opinions, start learning how the body works and start doing things that are going to make a lot of sense. So here's what's interesting. This past weekend, on a Friday afternoon, Friday evening, while a lot of people are starting to enjoy their weekend, I had the opportunity to learn at a seminar for 4 hours. Got home on Friday night about 11 o'clock, and we talked a lot about the immune system. So this has everything to do with what I want to talk about when it comes to the thyroid, because many thyroid problems are actually not a thyroid problem, but they're an immune system problem. In fact, earlier today I met with a young woman. She's been having all kinds of issues. Issues with her hormones, issues with her skin, issues with acne. However, one of the things that really concerned her was the fact that she had an abnormal pap smear. Now, I want you to remember this. When you have an abnormal pap smear, that has to do with a viral infection. And so infections and things like that are going to be so pervasive, especially this time of year when you have the flu season. So when I was learning about immunology earlier last week, one of the things that we learned is that bacteria, virus, things like that, they're in your body. Like, they're there. So strep is in your body. You have a strep infection. It's not an abnormal infection that you caught. It's already in your body, and it's just overgrowing because there's something in your body that's letting it overgrow. Or not letting it, but it can't overcome it, and that's your immune system. Same things with viruses. If you have a viral infection, you think chickenpox. So if you're one of the fortunate ones that actually were able to have the chickenpox naturally, you have that virus that stays inside of you for the rest of your life. And in fact, if you don't believe me, let your immune system get down, and when that happens, you develop shingles. So here you have the immune system. The immune system in your body is designed to always adapt and to always keep things in check. So you have all of these literally trillions and trillions of bacteria that live on your skin, live in your mouth, live in your colon. You have viruses that are inside of your body. And those bacteria, viruses, things like that, even yeast, they serve a beneficial role inside of your body when the immune system is keeping them in check. So bacteria help with the formation of generation of vitamins, generation of neurochemicals. They do a bunch of great things. In fact, they're the things that help you live. And if you didn't have them, you would become very, very sick. However, when that immune system starts to get depressed, you're going to start having things that are going to start to overgrow inside of your body. This is really important. So if you have a strep throat, for example, all of that is the normal bacteria starting to overgrow because the immune system is becoming suppressed. When I tell people, hey, is a staph infection, is that good or bad? And they're like, oh my gosh, it's bad. Where did you get that from? Well, staph live on your skin all the time. And in fact, you have an immune system that goes into your skin that's always keeping skin infections in check. So staph, you have strep, but let's talk about viruses and what it has to do with your thyroid. Now we're going to talk a little bit more about this at the thyroid event coming up a week from Saturday. So I think the date is like the 9th of November, and I left the registration link in the comments here where you can register for that thyroid event. So like I said, going back to this young woman, well, she had some abnormal cells on her pap smear that was showing that the tissue was changing, and the reason why the tissue changes is because there's a viral issue that's taking place. Now remember, the only reason why a virus is going to grow inside your body if the immune system actually gets weak. So that's why you always have to keep your immune system strong. The immune system is either going to work at 100% or it's going to work at less than that. So when you are looking at, hey, I want to quadruple my immune system function, really the only thing is you just say, how can I get my immune system to work normally? Because the normal progress, the normal progression of immunity is to get it to 100%. So going back to like these viral things, immune system gets down, viruses then start to go back up. Some of the biggest things that are going to actually keep your immune system down is going to be chronic mental stress, chronic physical stress, and then there's going to be chronic chemical stress inside the body. So if you think about it, if you are under long-term chronic mental stress, listen, that suppresses the immune system, because when you're under stress, you don't want the immune system working. You don't need it working in order to run away from the bear. If you're under some kind of chemical stress or chronic chemical inflammation that's taking place, here's a big one: food allergies. Or if you have a lot of chronic physical stress, and that's going to be on the spine, and that's going to be on the nerve system, and what that does to increase stress hormones when there's some issue with posture, some issue with disc herniation, some issue with chronic pain, things like that, and how that actually affects your cortisol levels. So when those levels are starting to go up, the immune system starts to get down. Listen, if you're eating junk food every single day and you're high stressed, your immune system is going to tank. And really, when you look at an improving immune system, you got to lower stress, number one, and number two, you got to make sure that the immune system has the right amount of food to be able to make healthy, normal cells that know how to respond. And this is where you start to go into things like vitamin D or astragalus or medicinal mushrooms, things like that, that don't raise the immune system. They just help the immune system to get back to normal while we start fixing some of the issues and why the body is in this stress state. So let's talk about the thyroid, okay? Here's the thing with the thyroid. So there are a lot of women, and right now I want you to share this if you know someone who has a low-functioning thyroid, hypothyroidism, or they have what's known as Hashimoto's thyroiditis, okay? So the number one cause of having a low-functioning thyroid, it's not nutritional. Although nutrition can play a role in it, but the number one cause is going to be an infection. An infection. So you're saying, well, what kind of infection is taking place? Well, I want you to think about this. I'm going to make sense to you, and we'll talk more about this at the thyroid event coming up a week from Saturday. So Hashimoto's thyroiditis is actually an autoimmune condition. Now, a lot of times people say, oh, my body's attacking itself. No, it's not. The body never attacks itself for no reason. The body never makes a mistake. And if you start thinking differently and you start thinking, well, if the body's not making a mistake, then what's happening is this. You let all of these stressors start to build up, the immune system starts to go down. Now you're going to have a proliferation of some kind of virus inside the body. In fact, many of Hashimoto's people who suffer with it actually will have a proliferation of the Epstein-Barr virus, okay? And this is known as monochronic fatigue. That's the type of virus that it is. So the immune system goes down, the virus starts to increase inside the body, and a virus needs another cell to live in so that it can replicate and that it can survive. So bacteria lives in and of itself. It just needs the right environment. But a virus needs another cell. So it needs to be inside of the cell so that it can copy and replicate. And once it does that, boom, all of the viruses, and then the cell bursts, and then the viruses go and infect another cell. So here's what happens, and why it happens so often when it comes to the thyroid. The thyroid is a highly, highly vascular organ. It receives a huge blood supply. So as blood is pumped up from the heart to go to the brain, some of it's going to pass through that thyroid. And the reason why it's such a highly vascular organ is because thyroid is responsible for metabolism and blood or body temperature regulation, things like that, which is so important. I'm here in Yorkville, Illinois, and it snowed today. And if I go outside, my body temperature is going to drop, and my thyroid, my brain have to adapt to that very quickly. So what happens is that any kind of viral infection, because of that increased blood supply that goes through that thyroid, that is an opportune place for any kind of virus to proliferate. I want you to think about it. Virus goes into one of those little thyrocytes or one of those thyroid cells, and when it goes into that thyroid cell, it starts to proliferate, starts to infect the cell. So the cell now has a virus inside of it, and whenever a cell has a virus inside of it and it says, hey, I'm infected, I'm sick, it's going to throw up a little flag right on its cell membrane that tells the immune system to do this. Hey, get rid of me, I'm infected and I need to die. So here comes the immune system along, and the immune system sees that flag, gets attracted to it, and says, hey, listen, cell, you're sick, you don't belong here, we need to get rid of you. So now the immune system says, all right, we're going to get rid of this little thyrocyte, and we're going to kill it, but we have to do that in order to kill off the infection. Because here's the thing, if we kill off some of the thyroid but the infection gets taken care of, you'll still live. But if you preserve the thyroid, never take care of the infection eventually is going to kill you. So the body is willing to do that and affect the thyroid if it means it's going to save your life. So what happens is, as the immune system goes down, the stressors goes up, the viruses go up, and now they're going to infect the thyroid, and then the immune system says, you don't belong here, we need to get rid of you. So how many of you have gotten a thyroid test and you are seeing that you have high TSH and you have a low T4, and that's the only test that the doctor has done, and they say you need to be on Synthroid, you need to be on it for the rest of your life, but you haven't gotten a complete picture. So you haven't gotten the whole perspective as far as why this is happening. Because here's what's going to happen. Every year you're going to go back to the doctor, and you're going to see that your thyroid function continues to get worse and worse and worse, and you might even have other issues start to happen. Because once you start to have some kind of autoimmune type response, you are opening it up to have other autoimmune responses in other parts of the body. And guess what one of the leading causes of death is in women 20 to 40? If you know it, go ahead and write it. Leading causes of death in women 20 to 40 is autoimmune. It is autoimmune. So, have you gotten properly tested? And in fact, we look at 12 different markers just when we are analyzing the thyroid to actually see, is this because of an infection? Is this because of a nutritional deficiency? Could this be because of a high amount of stress that's taking place inside the body? Or is there a problem with conversion taking place? Meaning, do you got a liver that's not working very good? Do you have a gut that's not working very good? And do you have a ton of other inflammation that's bogging down the immune system? And could you even have a problem with having iron or having low iron inside the body? There's all these different reasons why you're going to have a thyroid issue, but I'm going to guarantee you that just having a nutritional deficiency that's going to be fixed with selenium and with tyrosine and maybe a little bit more iron and maybe some zinc, it's probably not going to help you, because the number one reason why you have it is because of an infection. And one of the things that we have to do is we have to remove the stressors. Remove the stressors, give the body the components for the immune system to be able to work right, and then, and only then, we start to solve your thyroid problem. So remember, having a healthy immune system is why do people, some people get a stronger immune system when they take vitamin D? Because you need it for your immune system to work. Why do some people get better when they take vitamin C? It's for your immune system to work. But there's other things that are going to help that immune system produce enough cells so that you have enough of them to go around in order to constantly clear out those infections. Pretty cool, huh? I think it is. And I have an absolute blast not only learning this, but taking that knowledge and then helping other people who are suffering when they don't need to. So hey, if you're watching this on replay right now, go ahead and hit replay. Make sure that you share this with someone who is having a thyroid problem, and maybe you're having a thyroid issue as well. And I'd love the opportunity for maybe to be able to help you or guide you on this path to getting well. That's why we're doing the thyroid event coming up November 9th, I believe. Let me do the math here real quick. 31st, November 9th at 9 o'clock. It's going to be right here in this office, right behind those doors. And we're going to talk about the biggest reasons why women especially are having thyroid issues and how you can identify through proper testing what you need to do for you to be able to recover so that you can start living an awesome, awesome, awesome life. I think you're worth it. My next question is, do you think you're worth it? So guys, have a great Wednesday afternoon. I'm going to be heading back to start seeing patients here in just a little bit. And if you got a question, send me a message. I'd be happy to help or at least point you in the right direction. All right? Have a great day.